Nurse. Hello, a patient's name. I'm your name, and I'll be performing your physical assessment today. Do you have any concerns or symptoms you'd like to discuss before we begin? General appearance. Nurse. I'm going to start by observing your general appearance. You seem well-oriented and alert. Your skin appears warm and dry, with normal coloration. Vital signs. Nurse. Next, I'll take your vital signs. I'll measure your temperature, blood pressure, pulse rate, and respiratory rate. Measure temperature. Your temperature is reading degrees Fahrenheit, Celsius. Measure blood pressure. Your blood pressure is reading over reading mmHg. Measure pulse. Rate. Your pulse rate is reading beats per minute. Measure respiratory rate. Your respiratory rate is reading breaths per minute. Head and neck. Nurse. Now, I'll assess your head and neck. Your head is normocephalic and atraumatic. No tenderness or deformities noted. Neck range of motion is within normal limits. Eyes, nurse. Moving on to your eyes. Pupils are equal, round, and reactive to light. No signs of ptosis or nystagmus. Visual acuity appears intact. Ears. Nurse. I'll now examine your ears. Ear canals are patent with no signs of inflammation or discharge. Hearing appears intact bilaterally. Nose and sinuses. Nurse. Next, I'll assess your nose and sinuses. Nasal mucosa appears pink and moist. No signs of congestion or discharge. Sinuses are non-tender. Mouth and throat. Nurse. Now I'll examine your mouth and throat. Mucous membranes are moist and pink. No lesions or signs of infection noted. Throat is clear without. Erythema or exudate. Cardiovascular. Nurse. Moving on to your cardiovascular assessment. Heart sounds are regular with no murmurs, gallops, or rubs. Peripheral pulses are present and equal bilaterally. Respiratory. Nurse. Next, I'll assess your respiratory system. Breath sounds are clear and equal bilaterally. No adventitious sound, such as wheezes or crackles. Abdomen. Nurse. Now, I'll examine your abdomen. Abdomen is soft and non-tender to palpation. Bowel sounds are present in all four quadrants. No masses or organomegaly palpated. Musculoskeletal. Nurse. Moving on to your musculoskeletal assessment. Muscle strength and tone appear normal. No joint deformities or limitations noted. Range of motion is within normal limits. Neurological. Nurse. Lastly, I'll assess your neurological status. You're alert and oriented to person, place, and time. Cranial nerves appear intact. No signs of motor or sensory deficits. Result. Nurse. That concludes our physical assessment. Overall, deformities or limitations noted. Range of motion is within normal limits. Neurological. Nurse. Lastly, I'll assess your neurological status. You're alert and oriented to person, place, and time. Cranial nerves appear intact. No signs of motor or sensory deficits. Result. Nurse. That concludes our physical assessment. Overall, everything looks within normal limits. Do you have any questions or anything else you'd like to address?